Hi, welcome to Healing Tunes. Please watch the video. Radicular pain radiates into the lower extremity, thigh, calf, and occasionally the foot, directly along the course of a specific spinal nerve root and along the dermatome of a nerve or nerve root. Most commonly, symptom of radicular pain is sciatica, pain radiating along the sciatic nerve which run down one or both legs from the lower back. Next is radiculopathy, a disease of the root of a nerve such as from a pinched nerve or tumor. Next condition is herniated disc, which refers to pain problem with a rubbery disc between the spinal bones, and spinal stenosis, narrowing of the spinal cord. But some situations, these all conditions mimic only because of muscle trigger points. This session, we are discussing some lower limb muscle trigger points which mimic sciatica, disc herniation, disc prolapse with lower radiating pain and numbness. First muscle is the adductor brevis and longus. The distal trigger points tend to refer to the upper medial knee with spillover down the tibia. The more proximal trigger points refer to the anterior hip area. Trigger points in the adductor longus are the most common muscular cause of groin pain. Next muscle is the psoas and iliacus, primary to the lower lumbar area and sacrum, and secondly to the anterior thigh. These trigger points in the psoas and iliacus can mimic appendicitis. Next is the adductor magnus. These muscle trigger points, the lower trigger points refer to the anterior linear thigh. The upper trigger points refer pain deep within the pelvis. Because upper trigger points are in a sensitive area, work should be done through a sheet with a great deal of communication between the therapist and patient. The upper points are usually assessed with a patient supine with the hip flexed and abducted. Next muscle is the vastus intermedius. These trigger points refer pain downward over the thigh. Occasionally, the pain will spread upward. Trigger points in this muscle can be difficult to access since they are under the rectus femoris. Next is the pectineus. These muscle trigger points refer to the anterior hip just inferior to the inguinal ligament. This muscle is considered the fourth adductor. Next muscle is the sartorius. These trigger points in this muscle refer locally with the superficial sharp and tingling pain. This muscle got its name from its function of putting the leg in a cross leg position, which is common position for tailors, sartor. Then next muscle is rectus femoris. This muscle trigger points high up in the thigh refer down into the knee with spillover into the anterior thigh, one of the four quadriceps muscle. Then next muscle is gluteus medius. Trigger points near the sacrum refer pain into the sacrum. Trigger points in the middle aspect of the muscle refer down into the lateral hip with spill over into the thigh. The latest common trigger points in the anterior portion refer along the iliac crest and back into the sacrum. Dysfunction of the gluteus medius is a very common cause of lower back pain. Even when it is not a main actor, it should be checked for possible involvement. Next is the Quadratus Lumbar. The uppermost trigger points refer pain into the SI joint and lateral hip. The most inferior points refer to the buttock. The middle trigger points refer over the SI joint. Some people report a jolting pain to the anterior thigh from deep quadratus lumborum trigger points. The point that refer over the sacrum and causes sacral tenderness can cause a misdiagnosis of SI joint dysfunction. Next muscle is the gluteus maximus. The trigger points near the sacrum refer pain in a crescent pattern from the sacrum down to the gluteal fold. The most common trigger point location is at the distal position of the muscle and refer to the entire buttock and also deep into the buttock, which can lead to the false conclusion that deeper muscle are involved. The third trigger point lies on the most medial and inferior fiber next to the coccyx. The trigger points in the gluteus maximus can mimic back pain with their referral into the sacrum as well as coccyx issues with their referral into the coccyx. Next is the Iliocostalis. These muscles trigger points around T6 refer into the inferior portion of the scapula and also into the chest area, which can mimic angina. Trigger points around T11 refer into the mid back with spill over upwards into the scapula and down into the ilium. This point can also refer into the abdominal region, mimicking visceral pain. The trigger point around L1 refers deep into the mid buttock. Trigger points in this muscle, along with the longissimus and multifidus, are most a major factor in back pain. Next muscle is the Semi-Tendinosus and Semi-Membranosis. The main referral is up into the gluteal fold with spill over all along the posterior leg. These muscles are analogous to the biceps brachii on the arm and both groups refer upward. Proper hamstring length is elevated by having the patient perform a forward fold while standing. Sacrum should be level, not tilting forward or back. Next muscle is the piriformis. Trigger points refer pain into the sacroiliac region across the posterior hip and down the thigh. Trigger points in the other deep lateral rotators have the same exact referral pattern as the piriformis. Next is the gluteus minimus. Trigger points in the anterior portion of this muscle refer down the lateral leg and into the buttock. Trigger points in the posterior part of this muscle have a similar but more posterior referral pattern that does not go as far down the leg. Since the referral pattern of this muscle mimic sciatica, this muscle should be the first to be checked for involvement if the straight leg test burn out negative. Next muscle is the soleus. Distal trigger points refer down into the posterior and plantar surface of the ankle. Proximal trigger points refer into the posterior cuff. The rarest soleus trigger point in the distal lateral part of the muscle may refer pain into the sacrum. Next muscle is vastus lateralis. Superficial trigger points in this muscle refer locally, whereas deeper trigger points have a referral pattern that travel. Deep trigger points in the middle of the muscle refer all along the lateral thigh. Trigger points in distal part of the muscle can refer into the lateral knee. Next muscle is the tensor fascia latae. Pain down the lateral aspect of the leg, concentrating over the greater trochanter. These trigger points in this muscle can mimic trochanteric bursitis. Please subscribe the channel, like the video and share it. Thank you for watching our channel.